So finally we come to the last presentation, and it would be given by our Professor Vladimir Trajkovski. He is known as our Vice Chair and Working Group 4 lead. So let me to introduce him. Professor Trajkovski is known of his academic and research interests, which include human genetics, medical aspects of disability, physiology, and autism spectrum disorder. He is president and co-founder of Macedonian Scientific Association for Autism, and founder and editor-in-chief of the Journal of Health and Rehabilitation Science. Professor Trajkovski has led numerous international projects and published extensively in the fields of rehabilitation and autism research. So, Vladimir, the floor is yours.
Thank you, Professor Dragana, Milutinović, for this nice introduction. This is the last presentation, and I'm on a big exam how to get your attention. Now, my English will be not so good like Suzanne's, Kate's, Peter's, Margaret's, but I hope that you will understand me. I will not take you more than 15 or 20 minutes. Let's begin. It's time for siesta in Spain, but please imagine for a moment that you are with a lovely person on the Maldives, and you will survive my presentation. Okay?
It came out, it went off.
Yeah, please.
Just, can I?
Page down?
No, it's not showing on the screen.
Yeah, sorry, it's not showing. I didn't see the screen, sorry. Yeah, I need it.
No, you don't, it's fine.
It's fine? Okay. Sorry. What are the objectives of Working Group 4? Probably you would say that this is the easy job, and I will agree with that. But it is time-consuming, and our job depends from Working Group 1, Working Group 2, Working Group 3. And now I want to thank to all Working Group leaders for wonderful collaboration, and especially to Dr. Suzanne Denif and Françoise for leading this project. And we are on 3-4 months to go finished. Then our objective was to create a website, and it was created in the first 2 months of the beginning of the project. Communication, social media, Facebook, X, LinkedIn, Instagram, YouTube channel, and also newsletters. We published in open access journals, as my previous colleagues mentioned that. And I will show you after this. Main communication channel for action members and stakeholders. And also you saw previously that we also have today one member of European Parliament, and I hope that it will have a good impact to this project. What were our target groups? Researchers, as most of you are here, clinicians, policymakers, advocacy groups, people with intellectual disabilities, and also I am very grateful because we have today several of them together with us. What are the key tasks and activities of Working Group 4? Develop an open access and accessible CUPID website. And I'm sorry here that I didn't put so much pictures, but if you, probably all of you already visited at least once the website, there are a lot of photos, pictures, and it is very informative. Create an expert database and training instructions. As Suzanne said this morning, we have more than 300 members. Recruit cost-action members and early-stage researchers. Also, this project has a great impact on the early-stage researchers, and as previously was mentioned by Dr. Denis, I think so, in Amsterdam in 2024 was organized a very, very fruitful meeting. Promote exchanging, mobility, and STSM opportunities. We worked together with Dr. Tim Pell, who was responsible for STSM, and everything was announced on time on the website, and researchers got information in the real time. Facility access to healthcare and academic institutions was one of our key tasks. Then, what are key scientific deliverables and outputs? First, in the first year, we have created a CUPID dissemination and communication plan, and the document is on the website in PDF format. Creation and launch on accessible open access project website, I mentioned it. Development of easy read dissemination materials, and we produced several posters, easy read for people with intellectual disabilities. Also, we produced annual newsletters, some reports and communication materials, organization of open access webinars, annual conferences, preparation of midterm and final dissemination reports, support for publication and dissemination, outputs from WG1, 2, and 3 group. And also, one of the main tasks was to help in the organization and promotion of the CUPID final conference. For example, me as a chair of WG4 group, I was involved in organizational things, and also I was co-chair of the scientific committee, so I hope that we put some impact of this final conference. Also, some other members of WG4 group, which I'm grateful to all of them who took a part in this final conference. Dissemination activities was realized by continuously dissemination, I would say sometimes on a daily basis on the social media and the project website. Also, we produced, and I received and sent probably more than 3,000 or 4,000 emails in last 3 years and a half. Also, all publications which were sent to me by authors of open access articles were immediately posted on the website, and there were prepared print screens of the cover pages of these articles and disseminated on our social media channels. Also, we worked on promotion of inclusive cancer prevention knowledge. As Dr. Denis said, it is very important in such a kind of projects. Equal access to screening for people with intellectual disabilities and international collaboration and stakeholders engagement. I hope that this conference also will have a good impact on our international collaboration and for possible future project proposals. Dissemination was targeted to researchers, clinicians, policymakers, NGOs, family members, and carriers, and probably the most important, people with intellectual disabilities. What are the main outputs produced? Dissemination and communication plan as a document, CUPID brochure and promotional materials, posters. We produced between 30 and 40 posters. Also, 5 newsletters until today were produced and also published on the website and sent by me, from me by email. And sorry if I was boring you with hundreds and hundreds emails in last 3 years and a half. Open access presentation and 16 videos were already uploaded on the CUPID YouTube channel, and also probably some presentation from this conference afterwards will be uploaded on the CUPID YouTube channel. Accessible communication templates and resources in the final conference dissemination package you already received by email, and also it was distributed in last 2 months on social media accounts. What was the short-term impact in years 1 and 2? We hope that we increased awareness of cancer prevention inequalities among people with intellectual disabilities across Europe, establishment of an accessible dissemination infrastructure, social media platforms, newsletters, CUPID website. Here is the link if someone is familiar until now with the web link. We organized around 10 webinars across these 3 years and a half or more, a little bit more. Easy to read communication materials, and also one course by professionalists for creating easy read materials was organized 2 years ago. Improved networking and stakeholder engagement across Europe, greater participation of researchers, clinicians, NGOs, etc. Medium-term impact, year 2 to year 4, development of sustainable European knowledge sharing network, increased dissemination of research findings, policy papers, and open access resources, strengthening collaboration between working groups and international stakeholders, improved capacity building through organized training schools of the VG1, VG2, and VG3 group, and short scientific terms missions. Greater inclusion of people with intellectual disabilities in accessible health communication and decision-making process. And long-term impact, beyond the action, contribution to European policy and practice on equitable cancer prevention and screening, sustainable open access knowledge-based and dissemination resources, long-lasting international research collaborations and future EU funding initiatives, improved healthy literacy and empowerment of people with intellectual disabilities, support for reducing cancer inequalities and promoting equal access to healthcare across Europe, and continued dissemination through the CUPID final conference and future scientific outputs. I'm going through the accessible summary with pictures. What we did, we shared CUPID's work using a website, Facebook, X platform, LinkedIn, Instagram, YouTube, and newsletters. We made brochures, posters, and videos that are easy to understand. We organized webinars and meetings so everyone could join and learn. Each of them was open access, without registration fee. Why it matters for the science and for the broad and auditorium. People with intellectual disabilities often do not get clear information about cancer prevention. CUPID makes information simple and easy to read. This helps doctors, carriers, families, and self-advocates work together as a family. And what comes next? CUPID will keep sharing knowledge with researchers, clinicians, and policymakers. We will prepare a policy document at the end of the project. Tomorrow we will talk much more about that. Our goal is fair healthcare and equal access to cancer prevention for everyone. And I'm going to finish my presentation. Probably the the hardest part of my presentation. I must spend 1 or 2 minutes to Professor John Wells. Some of previous presenters also mentioned him, but also I feeling duty because he is the most responsible person that I'm vice chair of this project. I know him for 3.5 years, but I have a feeling that I know him for 35 years, 10 times more. If you can see on all 3 pictures, he's smiling. And I will remember him on that way. On the first one, on the left corner, that was the first time I met him in Lugano, Switzerland, on the kickoff meeting of CUPID. And the both two are from my university. My last meeting with him, we spent a lovely time in Skopje this February, 4 months ago. And nothing for me, especially. I was very surprised when I heard that he passed away. From this stage, I want to thank him for inviting me to be vice chair, and I hope that I finished my job as he thinks when he invites me to become a vice chair. And also, working with him was very easy. For example, on the New Year's Eve day, 31st of December, only in 2 minutes we arranged the conference in Skopje in February. These are my contact details. If you don't, but all of you probably know my email. This is social media of CUPID project, all our accounts. And conflict of interest statement. I hope that I was in 15-16 minutes finished my presentation. I am available for your questions if there are some. If not, Suzanne and I will close. Thank you. Thank you very much for your attention.
Thank you, Professor Trajkovski, especially for mentioning Professor John Wells, who was our first lead of this project. And I think that we all remember him by his smiling and his open mind. And also I think that we should be very satisfied what we achieved through our dissemination activities. And in relation to that, I would like to remind you to follow results of our final conference and like it on social media, or maybe some comments, because in that way we will be more visible. Please do that. Share. Yes, share. So we come to the end of first day, and I will invite our chair, our lead, Professor Suzanne Denif, to close this day, please.